let me just tell you, frame the issue that I see in Washington. And then I want to talk a little bit about, there's some issue about healthcare going on in D.C. It's about government versus freedom. It's about our Constitution. It's about what the role of government is. It's the reason why I voted against the bailout, because I didn't believe the government should be buying banks and auto manufacturers and intervening in business and start taking over businesses. It's the reason why I voted against the stimulus. We are going down a deficit path of $9 trillion now over the next 10 years. The national debt is $12 trillion. We can't sustain that. Our children can't sustain that. And the only way this administration is going to make that up is to increase your taxes. And we know that's the best job killer out there, is to impose tax burdens on small businesses and on the American people at a time when we can least afford it. And so after this massive spending that we've seen, then came a bill called the cap and trade. We call it the cap and tax. It's a national energy tax on every American. And then the president's own words, he said that electricity rates would necessarily skyrocket under my cap and trade plan and would be passed on to consumers. Now, why in the world would we want to be voting on something like that at this critical time in our economy? And if that's not bad enough, then we came with this great idea for a new entitlement program. We already have enough problems with the current entitlement programs. Now, we're going to have a national health care policy that I have to tell you, it's one of the most frightening things I've seen. This deserves a full and fair debate by the Congress. It should be crammed down our throats by this president with an arbitrary deadline. We need to have a thoughtful debate on this. And what they tried to do before this recess, I thought was obscene in terms of putting a gun to our head and saying up or down vote. Thank God there are enough of us standing up and enough blue dog conservative Democrats who said, you know what? No. We need to take a time out. And the American people deserve that. The American people deserve that. And so we're going home to our districts and we're hearing from the American people. Let me tell you the message I'm hearing loud and clear. You don't support the state. I think people want health care reform and they want it affordable, accessible to all Americans, but not a government-run system. And we can do this through private market reforms, through tax incentives. We have real solutions on the table to fix the system. But this proposal, in terms of businesses, I'm talking to the Chamber of Commerce, an employer mandate, basically saying you have to provide coverage. If you don't, you get an 8% payroll tax. That is a job killer. And every small business owner I've talked to has said that to me. And then the pay for it is basically $1 trillion tax. $1 trillion tax on small businesses and individuals to pay for this. This is a philosophical debate between, are we going down the path of our founding fathers who stood for freedom and liberty? Are we going down the path of European socialism? Because what they're trying to do is import the energy policy of Europe, which has tried and failed, and now they're trying to import the European healthcare model, which I don't know if any of you have been over to Britain or Canada for healthcare, but it's not the model for the United States. And I'm going to fight it. The public option, that's probably the biggest piece of this debate that's the most controversial. The public option basically is the government-run option. And to some people it has some appeal. The problem is private plans can't compete with it because you're not on the same playing field. And then the public option becomes the only option, and then the government is truly running our entire healthcare system out of Washington, D.C. Interestingly, if this is such a great idea, the public option, if if the members of Congress who support it think it's so great, then why, when an amendment was put to vote, to put all members of Congress on the public option, why did the Democrats shoot it down? Why did they vote against it? If it's such a great idea, then we should be on this plan too. And yet they voted against that. I think that speaks volumes about what the public option, really is. I don't want a federal health commissioner out of Washington, a federal health czar making decisions. I don't want this federal health board in Washington getting between me and my doctor and telling me what care is appropriate and what is not. If we go down the path of Britain and Canada, we can have rationing of health care, we can have waiting lines for seniors, life or death decisions. And the older you are you going to qualify for something or not? The Medicare Advantage program, which many seniors in my rural counties enjoy and works, gets cut under this plan. It really makes no sense. There's a better way. There's a better way to do this, a better way to reform it. And it's not by letting the government take over every aspect of our lives.